In our efforts to assess ourselves and continuously improve our organization and the services we provide to the community, the Alexandria Fire Department will implement an organizational restructure in June 2021. Over the past year, our team has reviewed various data, including response times, call volume, response coverage, and staffing to help us make a data-driven decisions that will benefit our workforce and the community. The upcoming changes will also enhance our emergency response capabilities and align our response coverage with the National Fire Protection Association, industry standards, and best practices. Our goal is to ensure a healthy and safe community for all.
The Alexandria Fire Department has made a commitment to continuous quality improvement by adopting the accreditation model designed by the Center of Public Safety Excellence. Accreditation has been recognized as an industry best practice, which includes community input as well as validation by an external group of our peers. AFD has been preparing for this process since January 2020, with several of our members completing required training and collaborating with fire service professionals from other accredited agencies across the country. One of the key components for this accreditation journey is the robust use of data. For AFD's upcoming restructure, we are using available data to strategically redeploy our resources to enhance our all-hazard service delivery across the city and improve resiliency with our public safety partners in the region.
Our department transports approximately 12,000 patients each year. With the organizational restructuring, nearly 50% of our suppression apparatus will be minimally staffed with one paramedic.
AFD's restructure is also part of our focus on being a high-performance organization and providing professional development opportunities. The changes will include enhancing ALS capabilities by adding EMS lieutenants on various units to ensure continued high-quality care during emergency incidents and enhanced training opportunities for our paramedic interns.
AFD will be creating battalion management teams, or BMTs. A BMT will have a battalion chief, an EMS captain, or a fire captain for all 3 shifts for the east and west ends of the city.
Our BMTs will work together as one functioning unit to comprehensively manage the service delivery the department provides to the city, with a prioritized focus on medical, fire, public service, and technical rescue events.
Additionally, our department prioritizes health and safety, and creating BMTs will increase safety by responding on the roadways. This will allow for one member of the team to focus on driving and another member to use the radio and laptop to collect information about the incident prior to arriving on scene.
With the addition of EMS lieutenants and minimal staffed ALS units, AFD's ALS resources will be strategically located throughout the city. This will help meet the demand for qualified and trained EMS professionals for various medical emergency calls.
Our inland water rescue team will relocate from Station 204 to Station 209 to provide efficient response to possible flooding incidents, which is currently a major concern in the city of Alexandria.
Inland water rescue and technical rescue located at Station 209 together will allow us to consolidate and provide necessary cross-training to staff members. Having multiple people trained in different specialties will ensure that we have adequately trained staff to respond to land or water rescue incidents every day.
This will allow for our staff to cross-train and share equipment in a fashion that makes employee development more efficient. This will also allow us to use existing facility space more efficiently to ease overcrowding at the team's current location, which gives our staff a better work environment. Consolidating these functions will allow a more capable emergency response during water rescue and other technical rescue incidents. National professional standards for technical rescue specify including swiftwater rescue as part of technical rescue teams. Meeting these national standards will help us to continue to provide high-quality services to the Alexandria community and to assist us in our journey of becoming a high-performance accredited organization.
Concurrently, our Hazmat team will be consolidated with our firefighting foam resources at Station 210 on Eisenhower Avenue. This will make it easier to cross-train staff, build capacity, and forge relationships with staff at major target hazards in the area, including the industrial park, the Norfolk Southern Ethanol Transloading Facility, and CSX Railroad. From Station 210, the Hazmat team will also have easier access to the interstate highway system, where national statistics clearly indicate that most hazardous materials emergencies occur.
At the very core of what we do, our goal will always be to provide the best service to our community. To do that, we must be willing to look at ourselves, evaluate how we operate internally and externally, and make the necessary changes to continue to become better. While reevaluating our operation, Alexandria Fire Department solicited and considered all feedback from our workforce. We reviewed the information and made changes to the plan based on the input from our staff members. Overall, the Alexandria Fire Department's restructure will implement a career advancement program for the EMS providers, improve our battalion management teams, and increase staffing and training for our technical rescue.
Our work doesn't stop here. In our journey toward becoming an accredited public safety agency, it is important that we take every opportunity to improve. The Alexandria Fire Department will implement the organizational restructure on June 12th, but we are also committed to paying close attention to our data over the next few months. And if there are other areas where we can make improvements or make minor adjustments, we'll take the necessary steps to ensure the health and safety of our community and our workforce.